Welcome to the Nursing Post podcast, All Nursing All the Time with Ashley Moore and Rosa Horsley. And in this episode, we discuss AIDS awareness as December 1st is AIDS Awareness Day. Our goal is always to inform and to start conversation.
To understand AIDS, we really need to start with how the process begins with HIV. So HIV is a human immunodeficiency virus. It is a virus that attacks the body's immune system and makes a person more susceptible to infections and diseases. It is spread by contact with certain bodily fluids of another person who has HIV. The most common way of contracting HIV is through unprotected sex, which is sex without a condom or without a patient being on HIV medications to prevent and pass along the HIV virus, and also through sharing needles. Untreated HIV can lead to AIDS, which is acquired immunodeficiency syndrome.
Approximately 1.2 people in the United States are living with HIV today, and about 14% of them, which is 1 in 7, don't even know that they have it. An estimated 36,400 new HIV infections occurred in the United States in 2018. Due to better antiviral treatments, most people live with HIV in the United States today without developing AIDS. If left untreated, HIV typically turns into AIDS in about 8 to 10 years.
Gay, bisexual, and other men who have sex with men, this is called MSM.
Which I just learned doing this episode.
Yep. Are the population that's most affected by HIV in the United States, and this was as of 2018. Most of our statistics are ending or from 2018.
And they are from the CDC.
Yes. MSM accounts for 69% of the almost 38,000 new HIV diagnoses in the United States. Black or African American men who have sex with men accounted for 25% of that almost 38,000 HIV diagnoses, and 38% of diagnosis among all men who have sex with men. Hispanic or Latino men who have sex with men made up for 20% of the new HIV cases.
Transgender people have experienced increases in HIV diagnosis. Mm-hmm. From 2014 to 2018, the number of diagnoses of HIV infection for transgender male to female, which is abbreviated MTF, and transgender female to male, which is FTM, adults and adolescents have increased. The largest percentage, 27% of diagnoses of HIV infection, was for transgender MTF adults and adolescents aged 25 to 29 years old, followed by transgender male to female adults and adolescents aged 20 to 24, which was at 24%. In 2018, transgender male to female accounted for slightly more than 1% of annual HIV diagnoses, and transgender female to male accounted for less than 1%.
Heterosexual and people who inject drugs are also affected by HIV. From 2014 to 2018, the number of infections attributed to heterosexual contact decreased. In 2018, 24% of HIV diagnoses were attributed to heterosexual contact. HIV diagnosis increased among people who injected drugs. That's PWID, people who injected drugs, with notable increases occurring among white people who injected drugs.
By race and ethnicity, Black African Americans and Hispanic Latinx continue to be disproportionately affected by HIV. From 2014 to 2018, HIV diagnosis rates decreased among the African American community. Among all race ethnicities, the highest rate was 32.9 for the Black and Afro American community. HIV diagnosis rates decreased among Hispanics and Latinx, and the rate for Hispanic and Latinx was 16.4. HIV diagnosis rates increased for Native Hawaiians, other Pacific Islanders. They remained stable among American Indian and Alaskan Natives and decreased among people of multiple races and whites.
By age group, from 2014 to 2018, the rate for persons from age 13 to 24, 35 to 44, and 45 to 54, and 55 years and older decreased. So the age range of 25 to 34 remains stable. So it seems like we're actually doing a pretty good job bringing numbers down.
Mm-hmm.
And it's all about
education,
knowing that you have HIV and then taking medications to decrease your viral load, because then you're less likely to spread HIV.
There are stages of HIV, and stage 1 is an acute HIV infection. People have a large amount of HIV in their blood, and they are contagious. For some people, they have flu-like symptoms. This is the body's natural response to infection. But for other people, they may not feel sick right away or at all. If you have flu-like symptoms and you think you may have been exposed to HIV, seek medical care and ask for a test to diagnose acute infection. Only an antigen or antibody tests or nucleic acid tests can diagnose acute infection. You want to hit early and hit hard. That's what they say when they talk about treatment with HIV.
Yes.
That is to hit hard with antiretroviral treatments before the latent reservoir forms inside the body. So the whole point of taking these medications and having treatment early is to get that viral load down,
right?
Because you want it to be almost non-detected,
right?
Because not only is that good for your body, but that's good for anybody that you're also in sexually contact with, you're being sexual with. The less ability that you have to spread it.
Right. Stage 2 is you're in the chronic stage of an HIV infection. It's asymptomatic, or it's also called clinical latency. The HIV is still active, but it reproduces at very low levels. This is a virus. So that's what you have to keep in mind with this diagnosis, is it is a virus. People may not have symptoms and they may not get sick at all during this phase. And without taking HIV medications, this period may last a decade or longer, but some may progress faster. People can transmit HIV in this phase. And at the end of the chronic phase, the amount of HIV in the blood, and that's what we call a viral load, goes up, and the CD4 cell count goes down. That's one of the things that we're looking at. That tells us how well your HIV is controlled. Mm-hmm. The person may have symptoms of the virus levels as the virus levels increases in the body, and it moves, into a separate stage. And people who take HIV medications as prescribed may never move out of this stage, which is really what we want, because
as of yet, there's no cure.
There's no cure. So we want to keep you in this chronic HIV stage with your CD4 cell count being high, your viral count being low, because then the virus is not reproducing as quickly, and the lower your viral count is, the less likely you are to spread it. Mm-hmm.
So stage 3 is AIDS, acquired immunodeficiency syndrome. This is the most severe phase of the HIV infection. People with AIDS have such a badly damaged immune system that they get an increasing number of severe illnesses, and these are called opportunistic infections. I remember, and even to this day, they talk about it in nursing school. Mm-hmm. They will tell you it's not generally AIDS that, kills somebody.
Nope.
It's usually an underlining infection like pneumonia or something like that.
Yep.
And so what AIDS does is attacks your immune system so that you can't fight off any other type of infection, really.
Right.
So people receive an AIDS diagnosis when their CD4 cell count drops below 200. or if they develop certain opportunistic infections. So in this case, tuberculosis. In resource-limited nations, TB is the most common opportunistic infection associated with HIV, and it's the leading cause of death among people with AIDS. People with AIDS have a high viral load, and they are very infectious. So without treatment, people with AIDS typically survive about 3 years. That's not long at all when you think about it.
Prognosis at all. There are many, well, not many, but there are different treatments that we're going to go into. I'm going to kind of cover the first part of them. So medicines that slow the progression in the body, that's antiretroviral therapy, or ART. I'm going to call it ART. So HIV is a type of virus called a retrovirus. So the combination drugs to treat those are the ART therapy. ART can keep you healthy for many years, reduce the amount of virus or viral load in your blood and bodily fluids. It also helps reduce your chance of transmitting HIV to others if taken as prescribed. So this is really the big thing that I know we keep saying it over and over again, that if you take your medicine like you're supposed to, it does decrease the risk of you spreading this. This is very important. ART is usually taken as a combination of 3 or more drugs to have the greatest chance of lowering the amount of HIV in your body. You would ask your healthcare professional about like multiple drug combinations, and you do have to change these medicines to be specific to your needs. Not all treatments are the same for each individual person.
Some of the common side effects of ART that you can experience include nausea and vomiting, diarrhea, which I want to say is a side effect to all medications ever made everywhere.
Yes, it is.
Okay, moving on. Difficulty sleeping, dry mouth, headache, rash, dizziness, fatigue, and pain. It's super important, and we keep reiterating this because I don't think people realize exactly how important it is. We're usually beating dead horses with antibiotics and when we talk about this, but it's so important even with antivirals. Okay, sticking to your HIV treatment provides many benefits. It allows the HIV medication to reduce the amount of HIV in your blood. If you skip your medication even once, you're giving HIV a chance to multiply rapidly. It helps keep your immune system stronger and better able to fight infections. It reduces the risk of passing HIV to others, and it helps to prevent drug resistance. And I know a lot of times when we talk about drug resistance, we're usually talking about, antibiotics and, make sure you take every last one so that you don't make it a superbug. Well, just imagine skipping every other day or once a week, your ART treatment. HIV, it does, change and mutate rapidly. And then your viral loads, depending on how many you've missed, that combination may no longer work for you because that strain that you have has mutated, and those medications that you were taking sporadically are no longer effective against the mutated virus that you now have. Right. So your medications have to change.
Right. And then at that point, your viral load is going to go up, and then you're going to be at risk for transmitting this to people that you are either sexually active with or people that you're sharing needles with. Ultimately, you want to try to decrease your risk of spreading this, because if you have this now super HIV and you're spreading it, then this is going to be harder and harder to treat. This is the same thing that happened with, MRSA, C. diff, things like that.
Absolutely. And other sexually transmitted diseases.
Oh, yes. You can listen to that episode. So, yeah, there is a little bit of a research that we did that was kind of interesting thought process that a connection made that I would not have known. So scientists have come up with a method for mapping in extraordinary detail the thickets, and they are slippery sugar molecules that shield HIV from the immune system. Okay. It's a virus that our immune system cannot fight off. Like the common cold is a virus, but our system fights it off. But HIV has these slippery sugar molecules that help shield the virus. So our immune system can't fight it off. Okay. And this mapping, it draws these shields, and those drawings give researchers more of an understanding of why the antibodies react to some spots on the virus and not to others. And what this can do is it can create a new path, a new way to create vaccines that target the most vulnerable sites of the virus. So it's really mapping in this crazy detail the virus and then trying to find the weak spot.
Mm-hmm.
So that way we can come up with a vaccine. I thought that was amazing.
It's definitely progress in research, most definitely.
Right. And this is a little nerdy of me, but I did a lot of reading. So just stick with me on my little nerd adventure. This is the first time that cryo-ME has been used with computational modeling to describe any kind of viral shield structure in atomic detail.
It's kind of like a map. I mean, that's really, exactly what it says. Yeah. It's like mapping DNA. It's just mapping
the virus.
This virus.
Right. And so the sugar molecules, they're actually called glycans, are loose and stringy, and they operate as a shield because they are difficult for the antibodies to grip and block access to the protein surface. The shields form on the outermost spike proteins of HIV and other viruses, including COVID.
That is interesting.
So this is our COVID-19, this virus shield that we're having such a hard time with. It's the same outer structure.
Wow, I just had a light bulb moment.
Oh, you're having the same light bulb moment that I did. I can see it on your face. I can really.
Wow.
So this new combined approach to show these glycan structures, and it's in a dynamic nature in such great detail, and it's helped the team and this team of scientists build a better understanding of these complex dynamics. And this team has discovered or has observed that individual glycans do not just like wiggle around randomly, which is what they thought, on the spike protein surfaces, but instead they clump together in tufts and thickets. So it's like they're working together to block antibodies. It's amazing. So these clusters of the glycans, or the sugary molecules, seem, like I said, to interact together. And in between the glycan microdomains is where the antibodies apparently have the opportunity to bind. Now, the research team is thinking, their vision is that their new glycan mapping method will be especially useful in designing and developing vaccines even beyond HIV, because many of the techniques that they're using for this,
they're using for other things,
for anything that has this glycan shield,
like COVID-19, like
the influenza virus, like COVID, and it can just extend on out. Those are just the two that I knew that most people would know about. But I mean, it would just play this great, it would just open up so many doors, because there are other things that have these glycan structures, and they're even cancers.
This is really, I mean, I really did have a light bulb wow moment, because according to this study that was published by the NIH, it was just last year, 2019, and they're saying that they could expect a sterilizing cure for HIV disease within another 5 to 10 years. That's groundbreaking.
It really is. And, you know, being able to, in the detail that they're talking about, and I mean, I paraphrase this a lot. It was really amazing to read that they're making this discovery. And because it's a virus, it's just going to open up so many, like, oh, maybe that's why we couldn't treat any of these other viruses. Do they have the same
This might be,
makeup?
This might be the foundation,
right?
This same model maybe the foundation on curing the common cold,
Right.
on curing the flu.
Right.
Curing HIV is just,
It would affect
this was also a pandemic.
millions.
It is still a pandemic.
Right.
So that's huge.
I mean, to me, my automatic thought was think about these third world countries, those patients who are susceptible to TB. It's their number one killer because they don't have the immune system. The TB, well, the HIV AIDS doesn't kill them. The TB does because they don't have an immune system to fight it. To have this vaccine developed and take it all around the world and cure HIV, then AIDS is gone.
It's such an interesting concept, and I'm probably going a little to the left because I always tend to do that, but I always come back.
Keeps things interesting.
I always come back. I mean, this is why compliance is so important, right?
It really is.
Remember, there was a vaccine for measles.
Yes.
It was once eradicated. So
Don't get me started.
I
You
know,
better get me started.
I'm going to the left. Let it be a lesson, and that's why I'm bringing this up. Let it be a lesson because measles was eradicated through vaccination, and because people started thinking, these false beliefs and reading the fake news. Immunizations were causing certain, disorders, and that's not the case. Science has proven differently.
Multiple times.
Yeah, we now have measles. So imagine the ability of being able to eradicate HIV and AIDS, and all it took was people being vaccinated. Just like children go now and be vaccinated for HPV, which is also considered a sexually transmitted disease.
Right.
That's being offered in your pediatrician's office. Why wouldn't you want there to be a vaccine for HIV that you could give to your children? I know I went off on a little bit to the left, but why I'm saying this is so important because when we have technology and we have things to help eradicate, diseases that kill us, we need to do more as a society, not only to protect myself, but to protect your fellow person. It's there for a reason. So I'm hoping that one day we'll get to the point where measles was eradicated. And I'm hoping that same thing for HIV.
And this was many years ago, but they had stated that if you have more than one sexual partner and that person's had more than one sexual partner, like
your chances of
getting it
yes
are astronomical. Like
everybody at some time, unless you're a virgin with a virgin,
right,
will have some form or fashion of HPV.
Right.
And we can do a whole nother episode on this.
Right.
But the fact that we're mentioning it is because it's sexually transmitted, and so is HIV and AIDS. And the point that we're trying to make by this is that vaccinations, they exist for a reason.
right.
And if the possibility out there to help your children not become ill and to keep, your neighbor and your neighbor's neighbor not ill, we should really be considering giving vaccinations.
Absolutely. And it's taken years. And I mean, this one study has us, about 5-10 years away.
Well,
That's
consider
really not a
when it
long
first
time.
came out. Remember when HIV, well, you're younger than I am. I mean, the 80s literally was raging, okay? Like they call it the raging 80s.
That's when I was born. It's wonderful.
But it was prevalent a couple of years before
Right.
then. So literally HIV has probably been around as long as I've been living. So I've heard it. So to tell me about 40-ish, give or take, years later, that there is a possible, cure coming in another 5 to
crazy.
10 years, that to me, look, I have goosebumps right now because that to me is just amazing.
goes to show you how science can progress.
Absolutely.
So
in my
quickly.
lifetime, something that literally was an epidemic and a pandemic, and now there might be a possible cure in 5 to 10. So, of course, the nursing considerations for this in regards to medication compliance and HIV drug resistance due to non-patient compliance. So, first and foremost, you just want to make sure that if you are sexually active as nurses, that we are instructing our patients to always use protection. I know, abstinence is, really the only form. However, that's not realistic.
It's not.
So instead of, getting on a soapbox and saying, oh, you shouldn't be having sex, you need to be educating people on how to have it safely.
Exactly.
So you want to make sure you're using protection. You want to make sure you're getting tested regularly. And, if you come up or have like an STI or an STD, make sure you're taking your medications like you should.
Yep.
Because with HIV, you have to take your medications exactly the way the healthcare provider tells you. If you skip your medicines even once a month or once a week, you're giving HIV a chance to multiply rapidly, and this weakens your immune system. And then if you become ill, that infection, that other underlying infection is going to be, unfortunately, the reason why you may no longer be here. So it's super important for us as nurses to just make sure that our patients are receiving their medication and try to help them in any way that we can.
Absolutely.
To make sure that they are able to receive and take their medication.
Well, and you need to think about, like, if one medicine's twice a day and the patient says, I always take it in the morning because I take all my medicine in the morning, but I'm really having a hard time getting that second dose in. Well, instead of saying, oh, sorry, you just need to remember, then maybe talk to the doctor and say, hey, the patient's really having trouble with this BID dosing. Is there any other combination that we can use that's just once a day? Because he's great with the once a day, or she's great with the once a day, but the twice a day, whether they're at work, whatever it is that they forget it, try to figure out what you can do to work with that.
And that's going to take some extra legwork on the nurse. And I'm hoping, and on the care provider. And I'm hoping, that you would take that second or that minute to sit down and discuss that with your patient.
Absolutely.
Because maybe it's just as simple as saying, hey, maybe you should put, 2 alarms on your phone or on your watch,
right,
to kind of help remind you, okay, you have to take your medicine in the morning and you have to take your medication in the evening.
Right. I mean, somebody might not want to pull out a bottle of medicine at
Absolutely.
work to take their HIV medicine. If people don't know, that might be something that they don't want to announce.
So you definitely want to talk to your healthcare provider if you do miss a dose. In most cases, if you realize you missed one, taking the medications as soon as you can and then taking your next dose as scheduled. Sometimes it doesn't work out that way. So you just want to make sure that you're keeping in contact and you're discussing these things clearly and effectively with your physician. It is easier for HIV to change form, causing your medication to stop working. So this is what the resistance is, and HIV can become resistant to your medication and to similar medications that you haven't even taken yet. So this limits the opportunity for successful HIV treatment if you're missing your doses and you're not keeping in current contact with your provider and discussing these with your provider. Once you become drug resistant, that strand of HIV that you have can be transmitted to others, like we talked about earlier. And then you're giving someone a super infection that can't be readily treated. If you continue to miss doses, like we said before, make sure you talk to your doctor. Our pharmacists, I think sometimes we forget about them.
Yes, and they're a great resource.
They are. Like, their whole job and reason for being is drugs.
Is medicine. Yeah.
It's drugs and medicine. So, like, if you have a question about your medication, don't forget, like, your pharmacist is a reference for that too. So don't shy away from asking questions. I had a 4th grade teacher tell me one time, the most dumb question you can ever ask is the one that you didn't. Yep. Because you'll never know the answer if you don't ask.
And you're not the only person that has a question. And quite frankly, and this is something I preach to my family, so many people are like, well, I don't want to look stupid. I'm like, who cares what they think about you?
Well, and
it's a gift to have.
Yeah. And I can tell you this, like, I've seen a lot in my years as a nurse. So unless it's a baby nurse, whatever you have to say is not going to shock and awe anymore. Nope. Honest to God, after you've been in nursing for a couple of years, anything that your patient tells you really is no longer a shock value.
No.
You're just like, oh, I've heard that before.
Yep.
So don't, you're not the first one. You're not going to be the last one. Just make sure that you're communicating, because as healthcare providers, all we want is for you to be healthy and happy.
Absolutely. As always, we'll link our references to our website, and that's thenursingpostpodcast.com. We would love for you guys to join the conversation either in the comments or on our social media platforms. You can find us pretty much anywhere. Please subscribe to our podcast, and thank you again for listening to The Nursing Post.